Thank you, Lisa. Up next, we have Randy Schwan with Trinity Health.
Good afternoon. So I thought I'd start out by giving you kind of a summary of our mass testing we did last week on Thursday at the Trinity Homes, the nursing facility that Trinity Health has. A total of 455 tests were conducted. 185 residents were tested. 270 staff members were tested. We have about 50 staff members to go who weren't able to come in on overnight notice and get tested, so arrangements are being made for wrapping that staffing testing up. And we have a handful of residents who results were inconclusive and are being retested. But of the tests that we've gotten back from the state lab, all were negative for the COVID-19 virus. So I'd just like to first acknowledge and give kudos to the staff at First District Health. Lisa Clute and her staff were amazing, helped us out on testing almost 500 people, 455 people in one day. It was smooth, it was well coordinated, and it was just amazing that we got the notice on Thursday, on the night before, and the next day we were testing and completed the testing that day. So staff did a great job at Trinity Homes. We're very proud of them. We're also thrilled with the results of no negative or no positive tests. Some of us thought that there might be asymptomatic residents or staff who would show positive for the coronavirus, but that wasn't the case. And so I think there's a number of factors that go into that, and we can talk about that later if you wish. So if there were positive tests, positive results either from that test or any other testing that we might do, we do have a plan for our staff, which includes daily monitoring and checking in with our employee health department during their quarantine of 14 days, and then there's a return to work criteria that they have to fulfill before they can come back to work. We also have a plan for any resident that might show a positive test as well. So we think we're pretty prepared, well prepared for that eventuality, and we didn't have to exercise it this last week, but going forward, we know that we're in a good position to do that. I wanted to remind folks about who want to be tested for COVID-19. It remains to be true that we are trying to test as many as possible. Those who have any symptom at all should call 857-7817 and arrange for a test. Again, if you have symptoms and wish to be tested, you have any symptoms and you wish to be tested, please call that number. You'll probably qualify for a test at Trinity Health. We have established a drive-through site. We've tested last week, I think we tested around 275 people.